Hi, I'm Dr. Nicholas Colivas, and I am a clinical professor of orthopedic surgery at University of California, San Francisco. I'm also the director of the UCSF Meniscus Preservation Center, and today I'm going to talk a little bit about horizontal cleavage tears. I have a case presentation of a lateral meniscus horizontal cleavage tear with a cyst decompression to show as well. But in general, if we're talking about horizontal cleavage tears, these are mostly degenerative. So for the most part, these are seen in older patients. However, that's by no means exclusively in older patients, and certainly in our younger patients, we see this sometimes, and we really want to try and repair the meniscuses on the menisci on those patients. Estimated to be about 24 to 40% of all tears, so a big category. And traditionally, these have been thought to be unlikely to heal, poor candidates for repair, and so in the past the treatment has really been resection for these cases. I think that's changing considerably maybe over the last 10 years or so now. The biomechanical studies certainly show that resection can increase cartilage contact pressures significantly, obviously leading to arthritis ultimately, and that repair of these tissues actually of horizontal cleavage tear can actually restore the normal contact pressures. From a clinical point of view, going back about 10 years, Kurzweil's study was the first systematic review to look at these carefully, and showed that the failure rate was really very similar to other types of tears, which is about 20%. But this study had quite limited numbers. Shen Mugarag's study at 2019 out of arthroscopy in a good number of knees showed 12.5% complication rate for repairs, so that's still pretty good, under the 20% or so for the general repair failure rate. But this was versus 5.1% with resection. So resection had a little lower complication rate, but still 12.5% is pretty good for these types of tears. And then a prospective study in 2021, the Stitch trial showed about a 17% failure or reoperation rate. Again, limited numbers for that study. Probably the most comprehensive review we have is the 2020 review from arthroscopy by Morris et al., which showed a complication rate of about 20%, reoperation rate of about 11%. So again, these are numbers that are really quite comparable, in fact sometimes better than some of the other tears we repair. So I think we feel quite strongly that we should be repairing these. Our case example today is a 33-year-old laborer, lateral-sided pain on his left knee, no history of trauma, is progressively getting worse. Actually even felt like he had some lateral swelling on that side. And this patient was interesting because he has on his other side exactly the same symptoms, treated surgically, and did very well with that. So was interested in the same surgery basically. His MRI shows a lateral meniscus tear with a parameniscal cyst, and this is the tear on the sagittal. You can see it horizontal cleavage there. The cyst itself was actually quite multiloculated, which is important at the time of surgery to go in there and make sure you break down all those loculations, and also extended anteriorly, as you can see on the axial. In our surgical technique, there really is circumferential compression sutures. So this is the actual pictures of the surgery at the time. This is the lateral meniscus here. You can see this is a tear, is somewhat complex. There's a little parrot beak component to it, but then that extends into the horizontal cleavage tear that we first start debriding. We also look at it from all angles. We're using our portals using 70-degree scope, and then we use the probe to break down the loculations and get into the cyst and remove all that cyst material as extensively as we can. Once we've really sort of broken through and opened that up, we'll get the shaver inside there, complete that debridement, and use the spinal needle and trephinate it, and make sure we've gotten all of those little loculations open. And then it's just a matter of using an all-inside circumferential device, placing sutures across. We like about a 3 mm gap between the sutures, really put in as many sutures as we need to. Usually start from posterior and extend anteriorly, switching portals if we have to. And this is sort of the typical result, a hay-baled meniscus that is held circumferentially. You can see these sutures nicely puckering up the tissue and holding it in place. And then we always do a marrow stimulation, venting to get some growth factors to flood into the joint and assist with that healing. Anything we can do to get this to heal is always helpful. So this is our relatively routine technique for these types of tears, and we've seen great success with this. Our post-op protocol, these are compression type tears, so we don't feel we need to restrict weight bearing extensively, so we do non-weight bearing for 2 weeks and then weight bearing and extension for out to a total of 6 weeks. Limit their flexion somewhat for the first 6 weeks, but after 6 weeks remove all restrictions and get these patients going. So in conclusion, we believe that these horizontal cleavage tears can and should be repaired when possible and not resected, particularly in younger patients. I think that we find most patients do very well. Of course, we do need further studies to see what the long-term, further than 2, 5, 10 years outcomes of these patients are. But given that we feel we've restored their contact pressures, we feel that this is important in preserving these knees and preventing arthritis. Thank you very much.